Hi, I'm Susan Rintoul. I'm a project lead in the Shaping Places for Wellbeing programme, and today I'm going to introduce the Place and Wellbeing assessments. So, firstly, why should we assess place and wellbeing? There's many factors that can affect our wellbeing, including the physical and social conditions in which people live, move around, access housing, employment, services, and open spaces, while feeling safe and included. And all these factors contribute to the value and quality of a place. So, if we think about plans, policies, and proposals in any sector, these can impact on these features of a place. And by considering these potential impacts, it can help to enhance the positive ones and realise any co benefits that they might have on our health, well-being, and also reducing inequalities. So, what is a place and wellbeing assessment? It brings together a group of stakeholders in a structured process to identify how a plan, policy, or proposal will affect a place. And the type of plans that are being assessed can range from a really high level policy at a regional level to a more specific project or proposal at a local scale. The Shaping Places for Wellbeing programme launched the use of the place and wellbeing assessments as an integral part of its ambition. So the programme focuses on the evidenced impact that the places where we live, work and relax have on our health and wellbeing. And as I highlighted before, this impact can be positive or negative, and the programme aims to ensure that any unintended consequences are fully considered when we're making decisions that impact a place. So, as you can imagine, with so many stakeholders involved in every place, this can be a really challenging ask. So, the programme uses the place and wellbeing assessments to address this challenge by offering a starting process to support decision makers in raising awareness of their impact on place. In particular, the Shaping Places for Wellbeing programme includes an awareness of those being impacted most by inequalities. So, looking at the process of undertaking a place and wellbeing assessment, it's split into three different stages. So, we've got the preparation, the session itself, and then the final report. So, the main part of the place and wellbeing assessment is the assessment session, and this pulls together expertise and perspectives from a number of different attendees into a room together and to consider how a plan, policy, or proposal is likely to impact on creating a place that promotes wellbeing. So the attendees do this by considering all of the features of our place that if we get them right, they allow those living, working, and relaxing there to optimise their health and wellbeing. And these features are called the place and wellbeing outcomes, and they provide a core structure for the assessment. So each of these outcomes are run through one by one, and the outcomes cover the themes of movement, spaces, resources, civic, and stewardship. An assessment also considers the impact on different population groups. And as I mentioned before, the Shaping Places for Wellbeing programme focuses on those experiencing most inequalities in the areas. So during the discussions in the assessment sessions, participants come together not simply to describe the impact on place, but also to inform a number of recommendations to be considered by the policy or proposal to enhance its impact on place. Following the session, a report is written up, and this provides a short description of the discussion that took place, any relevant research and evidence that sits behind the outcomes that was discussed, and also a number of recommendations for decision makers to consider to achieve the same. We've produced a how-to guide on how to undertake your own assessment process, and you can find a link to this alongside a link to our web pages in the video description, where you can find out a bit more information about the place and wellbeing assessments.